on the Zoom webinar, and I welcome all of you. And today, I think we start as we discuss how can we protect ourselves nowadays. Have many disease. They call the disease, but from few months, 6 months ago, I disclosed in this word to the in the my conference in the Dubai. I said there is no any disease, all the symptoms. We getting that one. They many therapy we don't have to we tell. They say these are the disease. I don't think so. They're disease because I'm not treating the disease. I'm treating the what the symptom and where from that symptoms came. Which organ giving symptoms? In as I told many times, in our body, we have to the full knowledge of the our body system. When we have the knowledge of the system, then we can realize, then very easily we can diagnose, very easily we can find out. I remember Dr. Joshi and Dr. Bhamra, they done one recording when I said Ayurveda is very easy, and they start smiling and say, so you saying easy, how can you say the easy? I say Ayurveda very easy when you understand. Everybody scared from flying the aeroplane. When they learn, they can fly, they can play with the aeroplane, play with the car. It depend on the how good driver are you. So Ayurveda, what is the our problem when we start find out our problem is come in our body when our organs and our glands are unbalanced, not in the tune. Our organs start suffering or our hormones start suffering, glands start suffering. Both way, when these are struggling, then they start giving us symptoms. What we do that time, people doing, they start suppressing them. That is the biggest mistake we do, patient do. And if we don't do that mistake, that then when the organ start giving symptom, they already affected inside. They try, our system try to heal themselves, look after themselves. When they can't do anything, when they gave up inside our organ, they call start, they're giving name to autoimmune diseases. Autoimmune system is problem. That is definitely autoimmune system is a problem. And so lot of in Ayurveda say Vishama, they call autoimmune disease. Then our organs are helpless, our glands are helpless. We have to make them again to workable. People, what they're doing, they start suppressing them. Doesn't matter any problem in the body. If the pain, we start taking painkillers. If other thing like a so many deficiency, we start taking that on the counter medicines or prescribed medicine, then we have to take whole life. Not the curing the organs, not the helping the organs, just every day feeding them, making them helpless, like a bypass everything. I always say people have the diabetes. When we start taking diabetes drugs, any, I don't want to put any name, how many people are, after they start the diabetic medicine, 1 year, 2 year, 3 year, 4 year, they cured? No. They start from 500, they go to the 2000. After that, once the other medicine added, after as one other medicine added, after that one other medicine added, build up the medicine only, and those medicine side effects start problem, heart problem, kidney problem, liver problem, so many problems. How they come, these are things, because we not treated that time pancreas. When pancreas is toxified, if somebody is good physician, you find that can cure your pancreas and pancreas start working again. Until you not cure the pancreas, it doesn't matter how many medicine you take, a diabetes never be controlled. They give the symptoms, pancreas, oh, I can't digest the enough that sugar, they're going to the blood. So if pancreas is working, then it doesn't matter. Before people eating lot of sugar, no any problem. When pancreas affected, actually the organ is affected. When organ is affected, that's the reason. Same thing in any organ, doesn't matter. Liver, kidney, lungs, heart, brain, gut, we suppress it. That should not be done. Those times I tell the people, go find the nice physician in your area. Many times I told this one, take your blood report, how you find the good physician. That is also I give the little tip to all my listeners. Take your blood report, go to any physician you think he is very good, give him your report. If that physician see the report and tell you 50% your problem, no need to tell him. He should tell you what is the problem in your body. Only he can cure you. Otherwise, waste of time. Which physician can find out the problem, cause of the problem, he can cure the cause of the problem. He can make the balance your system. Then you will become healthy, maybe take 1 month, depend on what is the condition you reach to the physician. If you reach very late, very damaged, maybe take long time. But good physician, expert physician who know the job, he can give you the results start within 2 weeks. If any physician, our body healing themselves, our body organs need just help to real help what they want, not the medications too much. If we make your organ workable, automatically our body is very intelligent, very expert. We have the doctor in our body. Nature make our body very strong, very intelligent. They automatically start little tuning if the beginning. But if we take very long, damage so many organ, one organ damage the organ, what is the related organ with that organ, they damaged too. So that is my advice to everybody. That is I'm doing. That is the reason people getting good result within, like I challenge everybody. If within 2 weeks you can't feel better anything, go somewhere else. And I telling every physician to this one, if you understand the job, you can start organ working in within 2 weeks. Doesn't matter in very condition, which condition, maximum you need 4 weeks. Within 4 weeks, definitely you start getting benefits. If they're taking very long time, you have to change the physician, not the medications. If you know the job, he can do this one. And till now, I've done the thousands of patients, and all patients, I say, this is the they seen the experience, that one. So we have to, when we have the problem in our health, we have to choose the right physician. First thing we have to, don't delay. If your body start giving sign anything, means they are already out of control. First, our body try to fix themselves. When 1 or 2 days or more than 2-3 days become this any problem, don't waste time on the counter, or don't waste time on the asking the relatives. Don't waste time on the YouTube or WhatsApp or this. Million people giving the remedies on the WhatsApp. No, you have to find the right physician, take your blood report, check up your full blood count. Then you can find what is the deficiency, what is the actually problem. Then you can save yourself. Our bodies, as I told you, our system is very intelligent. We can save ourselves if we don't delay. If we delay, take long time to cure, but still we can make our life livable. This is my advice to the first thing today. Thanks, Nehaji. What was our planning to tell our listener to how can we stay healthy and without any problems of our life, make our life happy and healthy life. That is our main aim. And any question from anybody, I'm happy to give the answer, and you can ask me the questions on that one.
So the first question, I'll take it from the chat, and it says, what's the cause of high amylase, to do with the pancreas, and the cause of food getting stuck in the esophagus? Had dilation done twice, but hasn't improved. So I think 2 questions I've read.
First question is for the pancreas. Pancreas also become the problem when our body have too much toxin in the pancreas. They called Vishama. They not build in 1 or 2 days. Actually, the problem of the most of the pancreatic people have the problem. They have digestion problem too. Maybe they are drinking too much alcohol. Maybe taking a lot of counter medicine. Maybe sometime people taking a lot of minerals without any consult anything. They go to the chemist. They think themselves, okay, take them. If they feel tired, pancreas start giving first sign to digestion problem. Before the diabetes, most of diabetic people, 80 to 85%, the people have the digestion problem. Their metabolism is but start giving problem. Then start liver giving a problem, not doing properly monitor the sugar level. Then pancreas already suffering. Then when we feel the tired, the people start go to take the multivitamin, multiminerals. That one is also all synthetic they are. And we feeding in our body lot of toxins more. So that time should be, if your body start giving sign, go to the check up your blood, and with the not only sugar level go high, maybe some other organ, liver or any bilirubin and anything problem, that one kidney problem we have, maybe have the other problem, maybe CRP level is very high. So check up that one and do the treatment. Why our pancreas become the problem? Our pancreas in Ayurveda we call Agnasya. That is related to liver and guts. Both of them, sometimes both is 3 of them is damaged, sometimes 1 is damaged. So pancreas, this is the for the esophagus, this one, and that is also sometimes not esophagus areas, maybe too much inflammation there. The reason also the gut problem. When the inflammation come in the body, gut problem is also problem there. And that the reason inflammation in the area, and there may be other areas too. And when that bend is too much swollen, that the reason the food is not going properly, and maybe they have the thyroid problem. They have to check these things. Once they check that one, that inflammation make the narrow the esophagus tunnel. So maybe sometime the problem of we have that they call digestive gland inside this one. When we eat food, they release their acid from there. If the acidic food we eat, they release there. Sometimes they become overactive. There's many reasons, but when you check the blood check, you can find that one. If this normal thing you can cure. If it take long time, better is you take the blood check check up your fully blood count, and then you can find what is the reason there. Any
I
other
think
question?
yes, there are questions, but is that okay? Everybody can directly talk to Dr. Singh, so making sure that I don't miss the question. If you have, please raise your hand, or you can speak, unmute yourself.
Sir, good evening.
Good evening, sir.
I'm Dr. Harsha. What Sir has spoke is very, very beautiful concepts regarding the symptom-wise how we should penetrate it. Sir, I have the doubt regarding the hypertension is the first sign for getting any abnormality from the heart. So mild to moderate, some exemptions of mild medication. If it is the moderate condition, the amlodipine like that things they are advising, and if it is severe, lifelong they are using. If it is the mild condition of the hypertension, how we can manage with our Ayurveda, and shall we evacuate the modern one and we can continue this?
With hypertension, is the problem is come when most of hypertension problem have the lot of stress or anxiety or anything. They also have this, they can't sleep properly, they have to control their relations or that one. I call them any blood pressure, and they have the symptom, that one. Most of them, they have the gut problem and liver problem. If there's blood is not circulating properly, not giving that one, that is a problem. Maybe lot of toxin in their body, in the gut and brain are working together, and maybe some glands are not working. If the Dr. Harsha, if you check that one, there are so many medicine for that one.
Yes.
Depend on the which medicine only we can give. If you want to quick result, we have to find out what is the reason of that one, and everybody have the different reason.
Yes, sir.
Not the same.
Nidana always plays a major role, that what Sir has told, because the lifestyle, high stress and anxiety, and so much of lifestyle disorder it is initially, and gradually it turns into the myopathy, or so many other factors was involved if you are neglecting this.
Yeah.
But most of the doctors, if you go and rush to the modern doctors, they advise amlodipine immediately, and they are, as you said, whether you are giving the medication, as long as your dependency is ultimately whatever the modern, it is especially hypertension and diabetes, and the chronic conditions, it goes to on, and symptomatically we are giving like that, it is not curing, as Sir has mentioned. That is the highlight of this program, that the curing of the medication is all the time Ayurveda it is carrying. But in the present lifestyle of the people, even in Ayurveda also, symptomatically they are curing most of the doctors. As the genuine doctors in Ayurveda also, it is lacking that curing aspects, the Nidana Tyaga, or Patyahara, Vihara, those are all the things is highly important. And curing aspects, the medication also is working very well.
Yeah.
If we are noticing genuine doctor like you, sir, that's what the doctor is talking like this. That's why in the hypertension, in the initial conditions, how can we avoid the medication, and at least lifestyle and all those things of remedy was there. And remaining aspects, as Sir said, gut cleaning or something, we have to concentrate. And what other factors?
This is the Dr. Harsha, as I told you, most of the hypertension, blood pressure people get the problem. They have the high blood pressure, that one. But their gut is also big problem. In the body, they the only come the problem, best way to do the, what I do, I can tell you. Yes. I made the one medicine we call Sarvaroga cleansing.
Okay.
That is my own formulation, and very much people like a panchkarma.
Yes, sir.
And when
recommend.
once we, because that my system is not like a panchkarma to do the vomiting of a woman and vrachan or anything.
Variation like this.
I designed that saptkarma.
Mm.
You no need to be woman, no need to vrachan. And secondly, the beauty, how I get the result. This is the you say right thing. We need to be detoxified first our body.
Yes.
That one is beauty of that one. I done that one, used on that one 18-month-old child to 100-year-old woman. And also that system, which one I designed,
Yes.
I give to the deathbed of the cancer patients.
Yes, sir.
They work very well, no any harmful, no nothing, no any problem. All my results are coming. Which one is people don't believe it. I mean, doctors don't believe it. We have some my patients in the group now. They can tell. After that one is people have the 200 maximum blood pressure. I cure 230.
Yes, sir.
And the down one is 119. And within 5 hours, his blood pressure came 160 and 99. And even any fever, we have the experience. If Dr. Yoshi there, he can tell you. And his fever become 40.5, and within 5 hours, 4 hours, his fever was 37. That one, once you give that one, we have the 4 type of, I designed that one, and 1, 2, 3, 4, and we can give, depend on the patient, depend on the situation, and until we don't detoxify the body, we can't cure anything.
Yes, sir.
That is the main culprit. You know the Vishama, you are Ayurveda doctor, very good doctor. I know you're doing a lot of practice on this one.
Yes, sir.
Always remember, that is the...
Because as my post graduation in Panchakarma, I do the same, sir. For all the patient, we are giving Siddha Virechana, and all. Afterwards we can start our treatments and all. We are getting best results, whatever the Pakshagata and all the conditions.
But that is, I say, I know. But which one I design, many people, we can't give the Panchkarma, you know very well.
Yes,
and
sir,
if the people are weak or old, too much old, very difficult to give them strong Panchkarma or any Panchkarma. Like a COVID time, people can't even breathe. And I give that one, my Saptkarma, and within 2 to 3 days, they become negative.
Very good, sir.
And all the cancer patient, I got the result now. That reason I say, there is no any disease, just you clean your body, depend on the Vat Pitta Kapha. All Acharya now, Ayurveda Acharya, if they diagnose properly, then I make the Saptkarma cleansing and Kada with them and diet. Yeah, 3 things we design for them, and the result come within days, not need months.
Yes.
We have the... I must we introduce there's Ila. She's Ayurveda student, and she got this one. Her partner have the very high sensitive CRP. Okay, 20 should not be more than 5. Within 2 weeks, they come back to.
Yes.
And ferritin was nearly 600. I said 5. I can't remember. And they come on the very low. Vitamin D is become very normal, very high. And other thing, he start feeling better within 2 weeks. If I done that one, and within what is the condition? If Ila can speak, Ila, hello Ila.
Yes, I can. I was just about to ask you.
I tell Ila can give the 5 minutes to the what she have the experience. about his partner and other, and she can tell, explain what was the case and what is the result now. Within four and a half months, I don't know, 4.5, 5 months now, and what he feel now, what hospital say.
Yes.
Okay. So first of all,
Ella,
thank you.
Ella, you go ahead now. Okay.
Can you guys hear me? Okay.
Yeah.
Yeah. Okay. So I'm Ela Sokolowska. And as Dr. Avtar said, I'm his patient. He's but also his student now. And I have came across Dr. Avtar beginning of this year, when end of February my partner woke up in the morning with a really bad chest pain on the right hand side. We have called ambulance, and then it turned out that he has the clot on the entrance, on the right entrance of his lung, which also had put a strain on his right hand side of the heart. So he had an emergency injection of enoxaparin sodium into his belly area, and after 2 days, he's been prescribed blood thinning tablets for 6 months and sent home, like, adios, arrivederci. And that's it. He was not told what the root cause is or any prevention. He was just sent home. And when we got home, just for your information, my partner is male and he's of the age of 62. And he got home being exhausted. He had no strength to climb the stairs. I mean, even getting up from the sofa was exhausting exercise. So you can imagine that we both felt really, really down and worried about his future. So we have approached few doctors of allopathic medicine, but everyone was just saying, you just need to stay on the blood thinning tablets. And any other doctors we have approached some Ayurvedic doctors, which we kept hearing, I'm really sorry, this case is too serious and we can't help you. I then came across, I contacted another Ayurvedic practitioner, Angela Hope Murray, and I said, come on, Angela, I really need the help. I need to find really good Ayurvedic doctor. I know Ayurveda can help. I just need the right person. And Angela Hope Murray referred me to Dr. Joshi. And Dr. Joshi again said, I'm really sorry, I can't help you. However, I know someone who can. And he referred me to Dr. Avtar, for which I am forever grateful, because our life has changed dramatically in a good way since. Dr. Avtar has first asked for explanation, what's the condition, which we have provided him with the CT scan results and some blood test that was done. However, Dr. Avtar has advised to do full blood count and other various blood tests, which we have done privately. And just so you have a clear illustration of what state my partner Michael was when we got to Dr. Avtar. So he had the pulmonary embolism, which is commonly known as a clot, with the heart strain. He had the pain on a movement, on a breathing deep. He had the lung tissue damage, which was caused due to the lack of oxygen. And he also had possibly there was some internal lung growth, and there was indication of small lung tissue death. And just as if that wasn't enough, the lung collapsed in the back area with a slight chest wall reaction. And overall, my partner has felt, it was this memorable day, 8th of March this year, when we both walked into Doctor's Avtar clinic, and my partner has all that conditions. And then we had another CT scan, which discovered that on the top of everything, he also has the small infrarenal aortic aneurysm, He had changes in the lower part of the rectum wall. I can see someone asked a question about the fistula ani. He also had one of those. He had enlarged prostate gland with indent on the bladder base. As Dr. After said earlier, his CRP, which is the marker for the inflammation, was extremely high, was 20, where the norm is up to 5. He had dangerously high ferritin level and a very, very high vitamin D3 level. He had very low iron, I think it was about 6 units, and very high uric acid. And it's no surprise that the gout attack very shortly followed that. So how did Michael feel on that famous 8th of March when we first came to Dr. Aftar? He felt very weak, very exhausted. He needed really frequent sleep. He had difficulties breathing. He felt very confused. He just could not feel straight. I had to be with him pretty much 24/7. I could leave him maybe for 5 minutes, but not longer. He just wasn't very alerted at all. It's just amazing how that the fact that the clot got to this maximum, well, to this dangerous situation, how that heavily impacted him. As you can imagine, he couldn't walk, he couldn't keep the balance, and his blood pressure was very low, and his oxygen level was also very low. His digestion was very poor with a lot of bloating. And as you can imagine, the gout attack was just the insult to the injury. But I keep saying about this famous 8th of March when we went to Dr. Aftar. On that day, everything has changed. And why has it changed is because Dr. Aftar has done this magic with his treatment. And he prescribed custom-made Ayurvedic medicine, which is, and I'm so proud to say that, is 100% natural and has given Michael no side effects whatsoever. He recommended some breathing exercises, very specially designed for Michael. He has recommended special diet, which was, again, very bespoke for Michael. He has spent countless hours over the phone and on the couch in his clinic, educating Michael and myself and raising the awareness about healthy lifestyle. And when I say healthy lifestyle, it's in a true meaning healthy lifestyle, not what you get on social media, Instagram or WhatsApp advice. And what was really appreciated, the Dr. Aftar didn't just see Michael in his clinic and then see you in 2 weeks or 4 weeks. He has followed all the time. Every day we received the phone call from Dr. Aftar, checking and following up. How's Michael? How are you feeling? And what was important was also bringing the mood and the energy level at high. Because as you may find out, Dr. Aftar comes across quite serious today, but he has really good sense of humor. And with that, what I personally value a lot, he's very, very compassionate, and he has a very personalized approach to his patients. And you can imagine how personal it is and how much I fell in love with it, that after that, I just said to Dr. Aftar, please teach me Ayurveda. I've been passionate about Ayurveda. I combine Ayurveda with my business, but I just wanted to learn Ayurveda from someone who comes from Gurukul background and has such a vast knowledge. And to my delight, Dr. agreed, and now I'm taking regular lessons from Dr. Aftar. But going back to Michael's case, just to give you some indication on the results, the iron is miraculously amazing level, is nearly 30 units, so from down. His testosterone level is up, which Michael is back to work. He's doing all his normal stuff. He's even painted the window, to my delight. His uric acid is normal. His vitamin D3 level is normal. Ferritin is very close to normal, although that was a month ago when we tested. I'm pretty sure that is back to normal now. His filtration of the kidney is very good. His liver functions is very good. CRP was already after less than 2 weeks back to normal. And if we talk about the how Michael is feeling, we can say that probably 95 to 98% increase of well-being, and his health is already to this point. So it's what, just over 4 months, 5 months, which we went from hearing that Michael will take months and months to recover, but he will never properly fully recover. His lungs will always be weaker and his heart will always be weaker. And this case is too serious to deal with. We went back to situation when Michael is pretty much in his best form ever. His problems with digestion completely disappeared. Like Dr. Avtar was saying, it's all connected, and it does make me smile. I don't know, guys, if you picked on it, but I love when Dr. Avtar is saying Ayurveda is simple. It has everyone has 70, well, unless you had organs removed, but everyone has 78 organs and 43 glands. And you just have to make the whole symphony play together nicely. And Ayurveda is simple. And I just love, because for me, Dr. Avtar is like a magician, like a conductor who makes this orchestra playing in the most beautiful melody that as a result gives a very good, healthy life and very good living. So I personally can't recommend enough Dr. Avtar. Obviously, you can imagine how delighted I am to become his student, and yeah, building my own business based around Ayurveda. And yeah, if you guys have any questions, I'm more than welcome, more than happy to answer them. But yeah, Michael is back to his normal self, very strong. He's even thinking about starting to cycling. He didn't tell Dr. Avtar about this yet, so we don't know for Dr. Avtar.
He just told me he wanted to go to the marathon last week.
Yes, so he's got lots of plans, but yes, he's back to his, I can't even say he's back to his normal self. He's better than he was before. And what Dr. Avtar has done and is doing, because I now have the privilege of seeing how he's treating other patients, is just incredible. I can see on the chat that there's also a question about the thyroid. There was a question. What's the question? I can't see that question. Oh, there we go. Hearty Solanki. Dr. Avtar, I have thyroid acid reflux. Recently, I have arterial fibrillation. Doctors are recommended to have ablation. Can you direct me? I don't mean to step into Dr. Avtar's shoes, but Hearty, I can tell you, I have witnessed another patient, a lady of age 46 who has came to Dr. Avtar clinic with very similar situation. She had problem with her thyroid. She was on the highest dose of the medication, of allopathic medication, and she was also told to remove or burn the thyroid. And after 4.5 months, her thyroid blood test results are normal. So if this is not enough for you to convince how Ayurveda is working, how well it's working, and what an amazing Ayurvedic Dr. Avtar is, I don't know what else can convince you. But yeah, I say my blessings to the universe and God every day for coming across such an amazing human being. So if you have any questions, I'm happy to answer that. Oh, did Michael had to change his diet as well as to take any Ayurvedic medicine? Sushma, yes, on a first visit with Dr. Avtar asked Michael what he likes, what he doesn't like. And based on that and based on what is needed for his condition, Dr. Avtar has recommended a very, very specific diet, which required me to be cooking certain dishes and making sure that I feed him with very healing and supporting his condition food. I don't want to say specific anything because I know that when people hear certain things, they hold on to it and think, oh, that will help on any conditions. I just emphasize the fact that Dr. Aftar makes very unique and tailored to each person recommendations. And any contact numbers for Dr. Aftar? Yes, I have shared the Dr. Aftar's website. I will share it again on the chat. So please have a look. And when you go to Dr. Aftar website, his telephone number is there as well. But I will copy that in a minute. Okay.
And anybody can ask the Neha, Dr. Neha, and she have already put it on there, and you can also give that one. Any about me, Dr. Neha also can tell. You can put on the website and my telephone number. And
I'm just doing it right now.
Okay, and all things she told me so much about me, and good thing. But I told her before, she follow my instruction like 100%. Diet, what I said, they done. This is the beauty. If people want to cure from this condition of the health, they have to give up their own other things. Should follow Ayurveda practitioner, which one, if the good you find, and diet is most important with the any treatment. And she follow that. I say to her, she done very good job, and without her following my instructions, is very difficult to cure Michael, because so many doctors and hospital they say they can't do anything. He stopped the apexaban after 1 month. No statin, no apexaban.
Yes, I confirmed that his Michael is no longer taking any blood thinning tablets, and even though we have because that's I forgot to mention it, when we went for the checkup, the D-dimer test for the clot has reduced greatly. It's still not in the norm because of the aortic aneurysm. However, this is it just makes me smile. When we go to hospital for checkup, they looked for the aneurysm sizes 4.5 on 3.9 centimeters, which was visible at the first CT scan. And when we went for the follow-up check, they couldn't find the 4.5 diameter, so they only found 3.9. And the lovely lady we've seen, she said, oh, I think there's something wrong with my equipment. So 3 weeks later, we received a letter to go for another checkup. And we went to a different hospital for checkup for the aneurysm. And the lady openly said, I need to look for the 4.5 or 3.9 diameter. She couldn't find it either, because as the time passes and the doctors after treatment is working, she could only find 3.6. So the aneurysm is reducing all the time, even though all the allopathic medicine doctors were telling us that this will never reduce, it will only grow bigger. So I live with the walking proof that it does disappear and does reduce. So I'm looking forward to the day when I can all come to you or any other groups who are interested to learn about Ayurveda and the Dr. Aftar treatments, and say the aneurysm disappeared, because I'm 100% convinced this will be the case. And where is Dr. Avtar Singh based? He's based in Croydon in London. There are very good connections to London, as you know. So yeah, I really recommend that. Any other questions for me? Okay, if not, I mute myself. I'm here in case.
Didn't get his phone number clear, full of his phone number. I could write only half.
Okay, his number is 07956 640
Yes.
643.
643. Lovely. Thank you very much.
For anyone's information, the telephone number is available on the website, but I can understand that some people might not have access to the website, but I've copied both. Okay?
Yeah, thank you.
You're very welcome.
You repeat it, please. Sorry.
Yes, of course. It's 07956.
Yeah.
640
Mm-hmm.
643.
And this is the doctor's number, yeah?
It is doctor's number, and he's very busy on WhatsApp, so you're more than welcome to message him on WhatsApp as well.
Okay. What was the name? Sorry, say it again, because I had a visitor, so I haven't been able to follow it. I was sitting waiting.
Okay, it's Dr. Avtar Singh.
Dr. Avtar Singh, okay.
Yes.
And he's based here, yeah?
He's based in Croydon.
Oh, that's far. Okay. All right. Okay. Thank you so much. Thank you.
Well, I don't know where you're based. I'm based in Kent.
I'm in Harrow.
Okay,
North
so
London.
I've got about an hour and a half drive to Dr. After, and I can tell you it is very worth it. I've got a queue of my family members who I'm Polish by birth, but
Yeah.
for the last 27 years I've lived in UK, and I've got a queue of family members who want to travel from Poland just to see Dr. After. And just today I've been talking to my friend from Switzerland who is also getting ready to come and see Dr. After. It's all these amazing stories of healing.
I'll speak to him. I'll speak to him and converse and then sort something out. Thank you.
I wish you all the best.
Thank you.
Are there any other questions for me? If not, I'll mute myself, but I'm here in case you need me. Thank you.
Yes.
Hello.
Hello.
Hello. Yes, I put a question of anal fissures on the chat.
Anal fissure. There's the what type of how old that one, and have you any treatment before, or there's very big or small area? They better you take the telephone number. Ila also told, and Dr. Neha have every details. You can
Right.
contact with the Dr. Arogyam, and
Okay.
they can give you, because this is the anal fissure is many type of anal fissure. Some is internal, some is external. Okay, and it's also internal, external. Better because this is the better you have the diagnose that one the system. I tell one thing for every disease. You have to be take the proper report. Then is easy to cure. With the Ayurveda, I always say 90-95% problems of the health, we can cure it. Ayurveda is very great, but Ayurveda can cure it. If somebody know the Ayurveda, how to cure it, depend on the what is the what kind of the position you find, and what kind is the problem. Every problem has the different kind of medicine. So I don't know how long that one, and full detail you can take it and send me to on that one, and I can try to help you. And this is the reason Dr. Neha done for this one community, and we are both to helping the community. How can people live the good and healthy life? Okay, and
Yesterday,
can I ask something?
Yesterday I went for Botox injection. Because they diagnosed it as anal fissures. But the problem is that I cannot open my bowels because the anal muscles are very tight, they said. So that's why they gave me Botox injection.
What is your name, madam?
Sushila Shah.
Shushila ji. As I told you, I don't know about the too much of the English medicine.
Okay.
What is inside, you can go and check that one. Most of the problem, they give the steroid or any kind of anti-infection drugs, that one. And you have to check that one. But with the Ayurveda, we have the different kind of medicine. We have the shit bath, and we have the creams, we have the medicine. And also if they have the inflammation in there, we have to reduce the first inflammation. We maybe take little time, but you can start feeling better within 1 or 2 weeks.
Well, I've had it for 9 months. they prescribed me the cream Rectosil,
Yeah.
and then that didn't improve. That was supposed to be for 6 to 8 weeks, but it didn't improve.
It's mean your problem is very serious, not
Yes,
the normal problem, and that is better. You contract after that one. Take the number
yeah,
from the Dr. Ila gave the number already to you, and doctor, if you ask the doctor Nehaji, and she also can give the number and everything, and you can take that one. Then we have to be asked some more question, need more information. Maybe you have some other problems. Okay, so better when you have time, when you feel to take the treatment, Ayurveda treatment, you can contact.
Only directly. It's better speaking directly than on over here now.
Yes.
Can I ask a question? Just a brief question, then I'll phone you. Can you do anything for a drop foot? Because I had a hip surgery and they've damaged my nerve, so I've got a drop foot. Or मेरा पाँव
You done
घुटन से ankle तक is numb.
Okay. And this is the issue. What you say on the drop foot, that one.
After hip surgery.
Who told you that the nerve is damaged?
The hospital, because I get electric currents going down my leg.
I know. Just give me the answer when I ask that one. Okay, hospital. Did they done the X-ray or MRI?
Yeah. They do the hip surgery all the time, so they know 1 in 300. They say it happens, and that's what happened to me.
Okay, there's which kind of the big sting they damage or the small nerve is damaged?
No, it's a nerve on the side of my leg, outside of my leg.
Okay,
I think it's a big nerve.
So I know so many nerves on that.
Maybe perineal.
Okay, but this one, they give you any detail of that one, or maybe is not the sure.
No. It is sure. I've been to the hospital.
Okay,
They've done tests and everything. I'm under a neurologist.
Yeah,
I'm under a neurologist as well.
Yeah, when you say maybe, is not sure. If you have the sure, and I need the detail of that one, what they done. They done already job, and let's we can see that one if we can make the strengthen that one.
I will call you because there's no point talking about it. They haven't given me in detail. They've just said I've got drop foot and my nerve's been damaged. They don't give you the details of it. This is 4 years ago.
She'll ask them if they done the any detail, but they are very professional.
No, they've done all that, and there's nothing they can do about it. Unless the nerve heals by itself. But it is 4 years old now, so it's not going to happen now.
Doesn't matter if they give you any detail, which kind of nerve, which nerve they that damage that one. If you have any report, then it's okay. Otherwise, we have to do our way. Then easy if you have the report from the hospital, because they done the surgery, they done the operation. Okay, what side of the hip they done, left or right?
The right hip, and it's outside of my leg. That the
outside. Hip is not the small area. The
hip is on the right side, and the damage is just under the knee, next to after the knee.
That is now I'm asking the question. They on the hip has so many area which area was damaged. They should definitely have the report. Okay, without the report, they can't do the surgery. Surgeon is only doing his job. Consultant and X-ray, everything they check before that one. I also do the body modality and marma therapy. So I know that one, what is there. Most of we don't need the surgery, my patients. We done all that one, but you done already.
Yeah.
And so that's damage is done. What we can try to, if I got the proper report from you, what I need. I can ask you that if you can find, or if you can't find, then you have to come to, we can check that one. And I can try my best. Okay. Within, I don't waste patients' time. If within 2 to 4 weeks, if you can't get any benefit, I say sorry. Then it's better to leave that one.
Okay,
that's my. No, I'm not saying take the 2 year or 3 year or 5 year. No, that is I. That is I'm telling even a cancer patient, I done so many cancer treatment. I tell the cancer patient, before you go to chemotherapy, give me 4 weeks. If within 4 weeks you feel better, carry on the Ayurveda. Otherwise, go to chemotherapy. But problem is people, they want to, not so many Ayurveda people getting so many patients. I'm not saying I'm the expert. I feel every Ayurveda practitioner is very good, very expert, better than me. If as I told you, you have to find the good Ayurveda practitioner. I told what is the best way to see. Take your report, give to him, go and one consultation. Okay, he asked the question, give the right answer. If he told you 50% what is your problem, actually, you know what is your problem. Every patient know what he feeling, what is suffering. If he tell you without you are telling to patient, to doctor telling the patient, means he can cure you. If he don't know anything, he can't cure, because Ayurveda is based on all the information and checkup.
Okay. All right. Thank you.
That's very very important. Then if you want to come to me, you're most welcome.
Okay. I'll phone you and then we can discuss.
You're most welcome, madam. Okay.
All right. Okay. Because I've got a lot of arthritis as well, like on the thumb, here,
you see,
like both
that
my
is
hands, everything. It's just like too much going on at the moment.
You don't have to tell me. Just give me your blood report. I can tell you. Okay, don't worry.
So how do I get? They don't give you the blood report. I can ask them to give me a copy.
No, Shishma, this is the biggest problem of our people. Some people, they're doing so much arguing what I need. They don't bother that one. I'm telling you, we made the blood what I need. I made the one system, count that one. I can send you what blood report you need. I need that one.
Okay.
You have to follow me, okay? And I'm asking the report. If you don't have a report, it's not mean we can't do anything, okay? That is easy for us to not spend a lot of time. If it's ready there,
yeah.
They are also doctor. They are professional. Every doctor I respect. Doesn't matter what they done. They check up big machines, everything. These reports are helping to you and also helping to me to do the fast treatment to you. I'm not saying I'm the perfect in the world. I'm best in the world. No, I'm nothing.
True. Okay.
I don't know how God giving me the result and people are happy from my treatment. I always say I don't know myself. Okay.
Okay. I only heard from the aneurysm because my husband died of aneurysm. His blood pressure is shot up over 200, and it was. He had a very big bleed. And when I heard that is the reason why I got the number and I phoned you just now. I spoke because I had visitors, so I couldn't listen to you.
For your knowledge, I treated the blood pressure. I told in this one up to 230 blood pressure going. The people they are not on the blood pressure medicine. Blood pressure is the only symptom. Why people taking the medicine? As I told in the beginning, there is no any disease. I'm a researcher. I made so many formulation for the cancer, for the COVID and everything, so many things. I'm telling the people, please be careful. Medication whole life is not curing. They're managing, even not managing. They're suppressing your disease and giving more and more and more toxins in your body. So if you have any problem, don't waste time. Find any good physician. Ayurveda has a great job. They can do Ayurveda people. If you find the right physician and go there and they can cure you.
Okay. Thank you.
Okay. You're welcome, sir. Madam.
Thank you.
I'm sorry, Dr. Aftar. Can I just step in? Just one thing. I just cannot resist. I have to say that. I remember going first time to Dr. Aftar with blood test results. And it was, when you go to, you always wish for the miracle ball to tell you, to predict your future. Going with blood test result to Dr. Aftar is like going to magician and asking to tell the future. The only difference is Dr. Aftar telling you the present. He looks on your blood test results and he asks you a question. Oh, problems with bloating? And you think, And he carries on like, oh, you had a gout attack? And you go, And then he goes on and on with the questions, and you sit there and you're like, yeah, yes, I have that problem. Oh yeah, I have that problem too. And you sit there and think, how on earth does he know? But this is exactly what Dr. Avtar is talking about. He's looking at your blood test results, and he knows from blood test results what symptoms you're getting, because he knows what organ gives which type of symptoms. Is honestly is amazing experience. If he then adds it to, I know Dr. Avtar, you don't like talking about the reading the pulse, but if he adds to the pulse reading as well, he just knows all your secrets. And to be honest, no matter how hard you try to keep something away from Dr. Avtar, he will know, because he knows, and he will tell you about it. So yeah, blood test is a basic indicator to go with Dr. Avtar. We personally, because of the seriousness of the case of my partner, we personally went privately. All the blood test results costed just under £200, but as you can imagine, the stakes were very high, and put that investment, and we repeated the blood test every month. But I know that NHS also does the blood test. You just have to wait, and there is that little bit of waiting, and not always the results come up correctly on the app. So sometimes you have to go to surgery and get them printed. But either way, you can obtain your blood test results and go with them to Dr. Avtar. So I just wanted to drop that, because I find it fascinating how Dr. Avtar looks at your blood test results and just knows everything about you.
Sorry, I have a question, please.
What blood test would you need? This is what I'm asking.
Just because you're anyway going to call Dr. Singh, I will allow Hansaji, because her question is long awaited in the chat as well.
Sorry.
Hansaji.
Okay, so I can very quickly answer that question about the blood test. There's no one answer fits all what blood test to do. This is where you need to call Dr. Avtar, say what your condition is, and Dr. Avtar will direct you what blood tests unique to you are required. Okay?
Thank you, Anna, but I'm taking Hansaji's question.
Okay.
Thank you.
You see, I hear about a lot of nut allergies, especially with children. So is there an Ayurvedic cure for nut allergies? I mean, I personally don't suffer from them, but I hear about this a lot.
Nut allergy mostly people have the gut problem from long time. Then the nut allergy is there. So maybe their liver is not functioning properly. And the nut allergy is from the childhood or just
children
when they were children.
Yes, I know of one 7-year-old who's got allergy. Another one is 12-year-old. They've got allergies. So I'm just wondering if there's a cure.
The cure is, as I explained, remember then why we have the allergy. Our main problem is on the gut allergy, not from anywhere else. And if gut is too much toxified, or maybe they have some other problem, liver is not functioning properly, then digestion system is not becoming okay. And then our system, maybe organs, glands are not balanced to giving the proper message to the digestion system to digest food properly. Many food, they become the problem in the body. How old they are?
One is 7 years old. The other one is about 12 years old.
Okay.
And my friend's daughter is about 13. Okay. They all have allergies.
Now, which age they start the allergy?
Well, it looks like from childhood.
In the childhood, no one eats the nuts on that one.
I mean, whenever they started eating nuts, they realized they were reacting to it.
And okay, I ask the one question to you: when they are born, do they have the stomach problems? Lot of diarrhea and vomiting.
Oh, I wouldn't know about that. No.
Now you know, you are the mother. If you don't know, who know then?
No, I'm not the mother. It's not for my child or anything. It's
about
okay. Yeah, it's about in general.
I think just to summarize. Yes.
Then,
Just to
then
summarize, I think this is very personal question. Dr. Avtar needs to know the details, and you will
Okay.
only know if it's your question, because he needs to know what actually started and where it's kicking off. So please ask your question, because you know the details and you can answer his question
Right.
before he
Okay.
answers
yeah,
yours.
if
Okay.
somebody
It's
else,
So
not
maybe I
general.
can ask these people to
Yes.
contact you directly.
So let Hansaji also allow him to share the numbers. They can directly reach out, because he has to know the specific
Yes.
details, and then he can answer those specific areas. Just to summarize everybody's question, I know that a lot has been taken and not every question was answered
Yes.
because of the time and restrictions. So just to summarize, if you are considering the Siddha Ayurveda and with Dr. Avtar Singh taking this forward, the first step is to reaching out him personally, and Ella has kindly shared many times the number on the chat box, even though Dr. Avtar is in the Siddha Ayurveda group of Arogyam, so you can reach out directly from the group as well. However, please feel free to reach out in any way you want. And then secondly, talk to him. He will discuss your personal questions, your conditions, and he will direct you. If you require any blood reports, you can ask from the NHS if it's been already done. You can take it printouts from your NHS surgery, just walking in the surgery and asking them for a printout, or NHS app is also available. You can download from there. Bring it back to him, and that's where the magic starts, where he comes back with the questions more in detail and finding more in solution. So again, very personalized and very much individualized approach for every treatment. So all the questions, when it says, can it help in this and that, he already answered in one go when he said Sarvaroga cleansing. And so correct me, Dr. Singh, if I'm pronouncing correctly. So it's about
Sarvaroga Saptakarma cleansing. Yeah.
Saptakarma cleansing. So his very unique approach is, no matter what disease it is, we label it with the name, it can cure everything. This is where his treatment approach is. So I will summarize every question's answer, what you have asked in the chat box. Can it treat that? Can it cure that? Yes, so considering answers from Dr. Singh, I can say it can cure everything. You just have to walk in and show him the reports he required, answer his question, what he's asking. And the very specific question might not seem relevant, why and what, but for him, it is very important to know, because that's where he will find his solutions for you. So whenever it does, make sure you do talk to him. We are very fortunate to have him on the board now with Arogyam, and of course for teaching, learning, sharing, and discussing Siddha and its approaches. We'll come back with next few weeks again with Dr. Singh and his magic stories, and I'm sure one of you would be up on place of Ella sharing your magical story with us soon enough. And so thank you again. I'm sorry if any...
I want to say something.
Yes, please.
Ayurveda is cure many problems. Depend on the what is the condition of the body then now. If people go the like stage 4, we can still make them livable life. Cure is word is 100% cure. If they come people first, second, or third stage, if the stage go to the 4, then you can make the body livable or cure both. If patient take the patient they have then take long time to cure what we done in the before, and then they become the curable life properly. But people don't have the patience to take the long time medicine, and depend on the condition, what condition you coming to the Ayurveda to me. If they coming first stage, very quickly cure everything. If they spend lot of time, lot of toxin in the body, a lot of side effects from the medicine, then we have to cure first the side effects from that one. Then his body start automatically working. This is very helpful. And thank you very much, Nehaji. You explained very nicely. And thanks very much. You gave me the opportunity to face the good people. They asked the very good question. And Ila and you and Harsha, then other people, all that one. And I'm always available, and you can ask the Nehaji. She's my captain, okay? And you can ask her any.
Thank you,
and
Dr.
Because,
Singh.
sir, one
It's a
more
privilege
suggestion.
working
One
with
more
you, and
suggestion.
I'm conscious of time, and not only rest of the world, but UK is also reaching to the dinner time. So without holding anybody more on the tables chatting, I will allow all of you to enjoy rest of your evening, and do get in touch, share your experience, write on a group as well where Dr. Singh directly can respond. Thank you again for joining. Let's not forget, starting Kickstart tomorrow morning again, 7:45.
thank you very much.
Thank you, everyone.
Thank you.